Well, welcome back to the Newsman Weekly. Joining us now, as promised, is Sherry Branham-Fonner, who's retiring, believe it or not, as the Executive Director of the Richland County Mental Health and Recovery Services Board. Good morning, Sherry. Thanks for joining us, and thanks for getting up so damn early. In fact, you were here before I was. Congratulations.
Thank you, Carl. Thank you for having me today.
We are very happy to have you. Let's dive right in. Now, Sherry, you've worked in social services in Richland County for I hate to say how long because somebody might think you're getting older, but 33 years. But go ahead. Take us back before then. Where did you grow up? I think when people hear your voice, they're going to realize you're probably not from here. When I first moved to Ohio, people thought I wasn't from here. I was from Georgia. But what attracted you to Richland County in the first place from your roots?
In regard to my voice, I've been here for 35 years, so you would think that my dialect would have changed, but it hasn't, so it does stand out a bit. I moved here in 1985 and stayed a year. My brother came down to Kentucky, picked me up. After much convincing of my father, he allowed me to come. Growing up in Kentucky, Wheelwright, Kentucky is the town I grew up in.
Wheelwright, Kentucky. What's the population of Wheelwright, Kentucky?
I don't know the exact.
Like
oh, my
10?
Goodness. I can tell you I graduated with high school with 44 students.
Okay, very good. So
very small community.
Very small.
And that included students from little surrounding areas, other little towns. Wheelwright itself was much smaller than 42 students.
Was it Wheelwright High School?
It was Wheelwright High School.
Oh, that's that. And Wheelwright attracting from other places. So at some point there was like a consolidation. So at some point there might have been like 6 kids graduating from Wheelwright High School. I'm sorry. I digress. Continue.
Growing up in Wheelwright was a very interesting life. It was an old mining town, and the steel corporation that came in when I was a child worked really hard to try to revitalize the town. In its heyday, the company, as they referred to it, built every amenity that a small community would want: pool, golf course, community house, hotel. And it was a beautiful little town then and has fallen into some disrepair as the years have gone by. But I grew up with a lot of guidance from my father and my mother. They were wonderful parents. They had farmland. We had 98 acres of farmland, raised pretty much any kind of animal that you could imagine. I spent my years in my youth running around the mountains, climbing trees, eating fruit that was from those trees, following my father like his shadow. And it was a wonderful childhood. My father was 70 when I was born. My brother, therefore, was 50 when I was born. And he had moved away, came to Mansfield, Ohio, via military, then Columbus. He moved to Mansfield and opened the first Kroger as the head butcher for the Kroger that had opened in Mansfield on Park Avenue.
Oh, okay.
Yeah.
I did look it up real quick just because while you were talking. Wheelwright population in 2020 was 509.
Very small town, yeah.
Down from 1,042 in 10,000 or in 2000. But I did look. I wanted to see what the heyday was. What was when were the people of Wheelwright, Kentucky walking in high cotton, as my relatives from Tennessee would say? 1950. There were 2,037 people living in Wheelwright at that time. That's way before you were born.
Yes. Yeah, way before. The town is a very interesting little town when you go there because the company, when they came in and started mining coal, they built the community. So there's all these small houses that the miners lived in. They went to the company store for groceries. Didn't really have to leave the community in order to have your needs met as a resident.
So you're probably like me. Mansfield was the biggest city that I had ever lived in, or in fact, it'll be the biggest city I ever live in because I'm never moving to Columbus or Cleveland or any place like that. But coming from Wheelwright to Mansfield, that had to be kind of a seismic shift in the way you looked at things.
It was very enlightening. My brother and sister-in-law were wonderful teachers. My sister-in-law, her name was Mildred Branham, and my brother was Art. They taught me so many things that I never learned as a child growing up in the Appalachia. and forever grateful. I owe my success to them.
Yeah.
They were wonderful human beings and treated everyone with love and respect.
Now, so you come to Mansfield, you said in 85?
I did for a year.
For a year, and then you left to go where?
Arthur and Mildred really encouraged me to go back to Kentucky and go to college.
Okay.
And I started college, oh my goodness, I graduated in 92, so back that up 5 years. It took me 5 years because I worked to pay my way through school.
Where'd you go to school?
Morehead State University.
Right. I know the nicknames of most every sports team, but I know Morehead State, but I can't think of the name. What was the sports nickname?
Eagles.
The Eagles. All right.
Classic.
We know somebody that went to Morehead State. The basketball
Ricky
coach.
Menard.
Yeah, Ricky
right?
Menard. I
Old
think
Mansfield
so.
senior. Yeah, I think that's right.
Yeah. If not, nobody will ever tell. So we'll be all right.
There's a famous football player that went there too, but I can't recall who it was.
No,
So
I'm correct.
Ricky
Menard.
Ricky Menard went to Morehead State. All right. What did you study at Morehead State, and why did you decide to study that?
My bachelor's degree was sociology. I began in sociology because in talking with the advisors when I started my education, I loved culture and, the different cultures across the country and the world. And it was always intriguing to me growing up as a child. Much of my entertainment I spent with my nose in the encyclopedias and, reading.
Heiser doesn't know what those are.
It's the old version of the World Wide Web.
Yeah.
Oh, like Wikipedia?
Yeah.
I know what an encyclopedia is. I went to school in the 90s.
Okay, yeah. We had Encyclopedia Britannica.
That was
did
what
too.
we had
yeah,
too.
yeah.
We did too.
I used to look. And every year they sent out an update book.
I never got the updates.
Yeah, we always got the
We only
updates.
had the
They were all, anyway, I'm sorry. I digress again.
So, in reading about the world through the encyclopedia, I wanted more for my life. And when Art came down to visit me, he brought me a graduation gift. And I was sitting on the porch, and I was upset because I didn't know where my life was going. And
What do you do with a sociology degree?
oh,
I know. You can't open like a sociology store.
well, my minor was social work,
Okay.
going back to that.
All right.
And I had an emphasis in criminology. So when I finished college, sociology, you could get a license in social work with a sociology degree. So that's the path that I took.
And coming to Mansfield with a minor in criminology at the time, that's perfect for what people were thinking in Mansfield in the early 90s. Criminology all over the place.
Yeah, I didn't do a lot with the criminology piece of my education, but it did help me understand the dynamics of the cultures that I was working with when I first started my career.
So you graduate from Morehead State in 92. Where do you go from there?
Moved back up here. My brother passed away while I was in college, but I came back up here and stayed with my sister-in-law. I was lucky enough to land a job just a couple days into the community and worked for the city of Mansfield for about 8 months. There was a school program for at-risk youth, and I began working there. I started networking and, of course, found out about children's services. Moved over to children's services after the 8 months with the city, and I worked at children's services for 15 years.
So you were there, or when you started, was it Jerry Fuddy?
Mr. Fuddy was there for about a month, and I went to his retirement party.
Yeah.
Then Dave Crocker took over and was there for a few years. Still a wonderful man, has done so much in regards to awareness of breast cancer. And
Dave's been on the show before.
Oh, has he
we
really?
had Dave on the show.
He's wonderful. He was always very supportive of the staff at Children's Services. Once he retired, Carol Brown became the director. And Carol was very supportive of myself and a couple of my coworkers. There were several supervisory positions that were opened because they changed the organization's dynamics some. And myself and two of my coworkers, we applied for those positions. And they gave those positions to us with the understanding that we would get our master's degrees. And all three of us did. And we got the promotions pre-masters. And then, of course, I was there for a few years as a supervisor, 3 years as a supervisor. and promoted to program supervisor, where I oversaw foster care, adoption, ongoing case management. We had a training program, a few other things thrown in.
Now, where did you get your master's degree, and what was your degree in master's degree?
My master's degree is in public administration.
Okay.
It's an executive master's degree in public administration. The agency wanted to know what that curriculum looked like. It was Golden Gate University, and that was, early on in online education, so it was vetted very heavily by not only the administration, but the board of directors at that time. And we finished 3 years. The three of us went for 3 years, worked full-time, did college full-time, and completed our degrees. And it was probably one of the best things that I did for my career.
Well, I'm glad you did public administration rather than like getting a master's degree in sociology or something, because I see people in my business, they'll get a degree in journalism, and then they'll go get a master's degree in journalism. I'm like, why? Why would you ever do that? What are you going to learn from a master's degree in journalism that you don't learn just by doing the job? If you're going to get a degree beyond a journalism degree, have it be something that's saleable, something you can market.
Sociology is so similar to social work. I literally took the same classes that people that were getting social work degrees took. I just love, human beings and the diversity in the country and the world. And growing up in the Appalachia, I understood my own culture and wanted to really understand the dynamics of culture in people's lives.
Now, what are your biggest or best or worst memories of how many years were you at Children's Services, and what do you remember most about those years?
I was at Children's Services for 15 years. What I remember most is a wonderful administrative team that taught the staff that, you make a mistake, you use that mistake as a learning opportunity. You continue to make that same mistake, and then there's disciplinary issues. But we were very fortunate to have great teachers in that administrative team that was there at that time. And once I began working on my master's degree, I really began to understand the dynamics of management of people and the importance of the treatment of people. You put people in positions that encourage them to work and make them happy. If you have happy staff, you have productive staff. You have people that, show up for work all the time. And I have carried that through my entire career as a manager, and believe that one of the most important things that a person can do when they supervise people is treat them right. You have much better outcomes. You get a lot better product, a lot, harder work, great attendance. It's incredible to see the dynamics of that in comparison to the last director that I worked under at Children's Services. My education really hit hard on the importance of treatment of people and the type of management that you use in managing people. And I saw it all come to light in regards to my education and how people are committed or not committed, work hard, want to avoid work. I saw that come to fruition as I moved into the last few years of my tenure at Children's Services.
See, Heiser, I've tried to tell you we have to treat Hayden better. Maybe he wouldn't get suspended so much if we actually did that.
That's true. I was thinking someone should have told you that like 30 years ago. If you treat people better, they'll work better for you.
Really? I always thought I was a nice guy. I'm just.
You've really softened up.
I'm just a big teddy bear now. But, all right, talk about the transition. You moved over to the Mental Health and Recovery Board. When did you make that move, and what was your role there?
I began working at the Mental Health Board in 2008 as Director of Program Management and Evaluation. Was a couple years and changed to Public Relations, Director of Program Management and Public Relations. And then I had a few different titles as we moved around and transitioned because of funding and programming, and ultimately ended up as Executive Director.
Well, let's talk about that. You took over the reins of the agency kind of during a tough time. I think it was back in 2023, so 3 years ago. Longtime director Joe Trollian departed, and you went from associate director to executive director in a pretty short period of time. What was that time like at the agency, and how did you help kind of calm the waters and steer the ship, so to speak?
The agency was really in a great place programmatically, funding, and I didn't want to do a lot of change that first year, so my administrative team and I looked at programs that we funded. Once you stand up a program in mental health and substance abuse treatment, you don't really want to pull that because you consistently have people involved in those programs. So it was important to us to carry through and carry on programs that were existing. We did a lot of evaluation during that time. We looked back at 5 years of service and the providers that we contracted with. We evaluated services by 15-minute increments and came to some numbers in relationship to what we wanted to fund, because programs are funded via RFP, and the agencies submit proposals for the programs that they want or need or have established. And we really based our programming and our funding outcomes on what was existing in the county at that time.
Now, just so people understand, the Mental Health Board, a county mental health and recovery services board, you don't have like 500 employees. You're not actually out there so much providing the services. You are talking to agencies or places, and they say, we want to do this. Will you help us get the funding? So funding flows from the federal government, the state government, local, flows to you, and then you flow that money out to agencies. That's kind of how it works, right?
That's exactly how it works.
Look at that, Heiser. I got that one right. I stayed up late studying last night, and finally something paid off.
Great job.
If I'd only done that at OU for 4 years.
Great job.
Thank you very much. So who were some of the agencies that you work with most in terms of providing the actual programming?
This year, we have 6 agencies that we've been working with. Those are our contract agencies, but we're affiliated with many other agencies. Our contract agencies are Catalyst Life Services, Family Life Counseling, UMADOP. We fund Casey, NAMI, and Coleman Health Services came on this year as a new agency with us.
Okay. So when you make decisions like that, and you were talking about early, one of the things that you did early was you looked at programs. I forget the actual title. But how do you evaluate? How do you go about evaluating, okay, this is doing what they said it was going to do? And has there been a time where you say, okay, this isn't doing what they said, so we're going to stop doing that? Because my experience with government is it tends to want to just keep it. Once it gets going in a direction, it wants to keep going, and funding keeps going. So how do you make that decision? Okay, we're going to do something else. We're going to try something different.
Well, any time in social services, you would have to pivot. And we have regular meetings with the contract agencies and our affiliate agencies and talk about what the service needs are in the community. Some of it's driven by Ohio Revised Code 340, which is the law that governs mental health and substance use services. We oftentimes will apply for grants, and the programming is very specific to the funding source and the funds that are provided via state or federal government. So, oftentimes programming is driven by the requirements of those grants, and the very specific outcomes have to be reported. When I took over as director, I really identified a need to more heavily track the outcomes and data, and I hired Scott Bassalone, who is our program director over all of the programs as far as social work, treatment, those types of things. And Mr. Bass alone really started putting together a lot of information. And I have a few statistics. I won't go heavily into that, but I'd like to share a few of those.
We love a few good numbers.
And we're currently compiling last year's numbers, so these would be numbers from the year before.
Okay.
But we serve 10,714 unique individuals as a system. So that would mean the 6 contract agencies that we contracted with delivered services to those individuals. Interestingly enough, 3,520 of those were youth ages 0 to 17, and 7,194 were adults over 18 years old. We also provided funding for prevention programs and served 16,899 youth in the school systems. We have prevention programming in the schools, education programming, but we also have school wellness programming that provides social workers in all of the school districts that help students, with life challenges. And so there's a nice gamut and array of services in all of our school districts in Richland County, and we're very appreciative of not only the federal and state government, but specifically the local government and the local taxpayer, because without the funds that they continue to support the board with, we would not be able to sustain the programming that we have.
You know what I think is the biggest mental health obstacle for young people these days, children? It's this thing.
Yes.
I got to believe.
He's holding up a phone.
Oh, yeah. Sorry. It's good for the video, but audio. Sorry. It's an iPhone, a tablet. It's the interweb. Do you see much, or do your agencies that you work with, is that an issue these days? I mean, whether it's online bullying or whether it's just got your head in your phone too much. I mean,
Or whether it's boomers like thinking AI videos are real.
Right. Yeah. I get fooled by AI all the time.
AI is so relatively new that we don't really have data on that. But what I can say is there are classes and education that's provided in the school system for the youth in regards to bullying, prevention, dating, violence, substance use, even down to cigarettes and vapes. Casey provides a lot of prevention education in the school districts, and they use evidence-based programs to do that. So I think we have some very solid services for our youth. And, just as parents have a struggle with their kids, wanting to use their phones all the time, we know that there are issues, and, that's where hopefully the students will engage in the services with the clinical staff that we have in the schools.
Yeah, it's funny. When my youngest son was coming of age, I think he was in junior high or whatever, and it's back when you used to get your phone bill, and it would, like, every time somebody sent a text, there was a little thing. And not that you get paid to pay for all of them, but you got this list. And I saw it in his. I said, God, Zach, not this Zach, my Zach. I said, you had like 5 million text messages last month. I said, why don't you just call people? Why don't you talk to people? He goes, well, if I call him, I can only talk to one person at a time. He'd lay in bed at night texting. Yeah. And I'm like, thank God, it was way before you could actually get on the internet on your phone. But yeah, it drove me nuts.
Well, I have to support Zach and his explanation of it's easier to send a group text than it is to have a conversation with 15 different people. So, good for your son for being able to explain that.
Now he sends me text messages on WhatsApp, so he's still doing stuff all the way from Barcelona. You know how we stopped bullying back in my day, Heiser? He loves the back in my day stories. You know how we stopped bullying?
Yeah, how you stopped it?
Yeah. We thumped
More
them.
bullying?
We thumped them.
Yeah.
You went outside to the playground and you thumped them.
Right.
You said, there, bully, shut up.
Right.
That's probably not good mental health counseling, though, is it?
Probably
Physical
not.
violence, no. All right.
No.
Mental health.
Can't endorse that.
Yeah, I know.
I do not endorse that.
We do not endorse, but you know what? It was effective, at least momentarily. All right. Mental health needs have obviously changed a lot since you started. What was the biggest challenge that you faced, especially if you talk about the opioid crisis or the COVID-19 pandemic? I mean, everybody was freaking out during COVID. Well, except for me and Heiser, we were okay, but everybody else was freaking out.
Mm-hmm.
Traditionally and to this day, one of the biggest issues that we faced, one of the biggest challenges that we faced is fighting stigma. People can be very hard on others that have mental health issues. We're talking about bullying or substance use issues. And we really work to try to reduce the stigma. And I do believe it's gotten better. I think the younger generations are much more engaging and supportive of treatment and of their friends and other people that they're involved with at school. Maybe not friends, but we do see young people specifically, providing a lot more support and being much more open-minded about having a mental health issue. So that reducing stigma will continue to be a struggle, but I think that we've made some positive strides in that regard. With substance use, trends come and go, and some of the drugs that are in our community now, are very, very harsh drugs. They're taking lives.
Yeah, fentanyl kills people.
Yes,
don't do
fentanyl.
that. Yeah, see, public service announcement from the Newsman Weekly: don't do fentanyl.
Yeah. So, seeing people lose their lives to the chronicity of that drug and the harshness of that drug is very saddening. And what is probably most difficult in that regard is you never know what that is going to be in, what fentanyl is going to be in.
Right.
Street drugs often will have that. We've lost people in Richland County to overdose because of fentanyl. And, it kind of comes in trends. Tony Tambasco's I think he retired, but
he did.
He was wonderful to kind of keep us educated on what was being seen in the community. And, there was times when fentanyl would hit this community harder than what the average was. And, he would bring attention to that. So, our providers were aware of what to look for. And so, the chronicity and the harshness of the drugs and the ever-changing cycle of what is out there and what is in those street drugs is a great challenge, Carl.
Yeah, I met Tony, good Lord, back in 1990. For those who don't know, Tony was the lead forensic chemist, scientist, one of the smartest guys I ever met. Absolutely. At the Mansfield Police Department. And when I would talk to him during those days, I would say, Tony, help me understand why drug dealers would want to put something in their drugs that kills their customers.
I've said it 1,000 times.
And he said, Carl, I'm a scientist. I'm not a businessman. I have no idea. I said, well, Tony, thanks. That's very helpful. All right. It doesn't make sense.
No.
Why do you want to kill your customers? And you have people buying what they think are maybe, shouldn't say it, but they're just opioids, right? I'm just buying some opioids. What I don't know is these are laced with this drug that's about to kill me.
Wanted to just take a moment to comment on mental health as well. One of the greatest challenges that we're facing is funding. And we're very fortunate in Richland County to have a levy that our residents have supported for decades. And, with some of the upcoming laws that are being proposed.
Do away with property taxes, and guess what happens then, folks?
Well, you don't have funding to provide mental health and substance use treatment. You don't have funding for bridges and roads. You don't have funding for schools. So as time moves forward, you do away with that tax base, and you'll start to see the decline in our community really in every direction. Mm-hmm. So really thankful to the residents of Richland County for that continued support.
Yeah. What do you think people misunderstand most about your agency and the work you do?
I think the greatest misunderstanding is that we are not service providers. We contract for services. We're a small team. There's 7 of us, and we contract out for those services based on what the identified needs are in the community. I think people look at the Mental Health Board. I think there actually is not a lot of understanding of what the Mental Health Board does, Richland County Mental Health and Recovery Services Board. I don't think there's a great understanding of all of the services that are delivered and monitored, evaluated under Ohio Revised Code. The board is the funding, monitoring, evaluating, and planning entity for mental health and addiction treatment. So I don't think people realize that we not only fund, but we monitor, evaluate. It's a constant cycle of what we're doing to ensure that our community needs are met.
Now, what do you believe is the most important message, based upon maybe it's that and beyond, the most important message the public needs to hear about the work that you're doing? If you could communicate one thing to every resident in Richland County about the work you do.
Well, historically, 1 in 4 people can be diagnosed with mental health issue or, diagnosis. And that means your friends, neighbors. I think everyone in this county would know someone that has struggled with mental health. Maybe, not a long-term issue with depression. It may be situational. But, we all know someone that has struggled. And knowing that, we actually created, it's called Richland Recovery Network, and it can be found at richlandrecoverynetwork.com.
We'll put that link in the show notes, Zach. Make a note. Yep.
That website is very streamlined. DRM helped us set it up. We have 6 contract agencies on now, and I just was talking at the board meeting this month that we need to start adding some of the affiliate agencies. We're affiliated with Ohio Health, Avita, Akron Children's Hospital, Healing Hearts. We have a whole list of agencies that we're affiliated with, and we need to get those agencies added to Richland Recovery Network. But if you go on to Richland Recovery Network right now, there's a few questions. There's 2 pillars on that home page. One is crisis focused, one is service focused. Mm-hmm. If you click on services, it'll take you to a whole plethora of information. Crisis is pretty defined, 911, or the crisis helpline, which is 522-HELP, 419-522-HELP. Catalyst mans that crisis helpline 24 hours a day, 7 days a week, 365 days a year. But moving over to the second pillar and the services, there you click on that, and it takes you to a second page, and it will ask you adult or youth. What are you looking for? You click on adult. It'll bring you to 4 pillars, and I think I have this order correct, but it'll take you to 4 pillars, and it's mental health, substance use, advocacy, education, prevention. So if you're looking for one of those services, you would click on that. And then, as an example, a couple clicks, and if you're looking for withdrawal management or detox, which is kind of the common language, you find the agencies that you can seek out help from in regards to detox. Catalyst runs our detox facility here in Richland County. And then, the hospitals, of course, if people are really in bad shape and need medical care, then they can go there. But, you kind of titrate all of that information down in 5 questions, and you have the answers of what's available here right in your own community, instead of surfing the World Wide Web and finding agencies from Columbus and Cleveland and Akron and even other states.
Or Mansfield, Texas.
Yes,
Yeah,
yes.
yeah.
And so Richland Recovery Network, that is one of the biggest messages I would like people to really hear and understand, that if you have a loved one or a friend or a neighbor that you need help, that needs help, you can go on richlandrecoverynetwork.com, answer a few questions, and you'll know what agency to reach out to in regards to substance use treatment, mental health treatment, advocacy, prevention. There's a whole gamut of services. And then the links that you click, if you click withdrawal management, it will take you right to Catalyst page, because we have a detox facility, a withdrawal management facility right here in our own county. So, I'd love for people to really understand that resource is there for them, and and there's help. There's help for anything that a person needs. Right here in our own community, there's help.
Now, one of the things I know you guys do, because get involved in it, you're an agent or you're an organization that funds NAMI.
Yes.
And NAMI does twice a year crisis intervention training.
Yes.
With local law enforcement officers. That also includes the security at the hospitals. It includes dispatchers. It includes people who work in correction facilities, which I always thought was valuable. The way I get involved is at graduation time. After their week-long class, we go in and we role play at the Mansfield Playhouse, and we do things to give them practical on-the-job training. And those are always fun. And I think I forget how many hundreds and hundreds of law enforcement officers have gone through that training thanks to your funding of NAMI and the folks in that organization.
We are very blessed to have a strong CIT program here in Richland County, and thank you for always participating in that, Carl. The work that you do really gives the officers and safety service staff opportunity to have sort of real life experience, I mean, it's of course a role play type thing, but it really, I've seen those role plays many times, and it really provides a very realistic experience for the officers that go through that training. Aubrey Hall does an incredible job, as did Mary Kay Pierce, who was the original director of NAMI. But crisis intervention team training really teaches safety services staff how to react when they think there may be a mental health issue that is presenting when they're out on the streets working with people. And people that may need help can identify those CIT trained officers because they are given a pin and they wear those pins. They're very proud to have went through that 40-hour curriculum of training. They're taught about various drugs, various diagnoses. We have a lot of people that come in to talk about the services of their organizations or their personal life stories and experiences. So CIT training is a very, very wonderful tool, and the board funds those classes through tax dollars. And without those dollars, we wouldn't have the flexibility to be able to provide those trainings to all of our safety services.
Good. Now, if you could wave a wand and change something in the way mental health and recovery services are handled in Ohio, what would be that one thing that you would change? You are now the empress of mental health and recovery in the state of Ohio. Fix it.
Fix it.
One thing. You only get one.
Consistent funding for services that saves lives. Programs fluctuate a lot. And over the last 18 years of working at Mental Health and Recovery Services Board, I have seen programs stood up and funding available, then funding goes away, and you have to pivot. And, we never allow anyone to not have services that they need in regards to programming. We try to sustain the programs that we stand up. But, funding plays such a vital role in the stability of services throughout not just Richland County, but the entire state and country. And I just hope that as we move forward and the new administration takes over, that they see strong support. Right now we're waiting to hear from the state what is going to be funded, and we're getting ready to go through the budget process, and trying to budget for programming without knowing what funds are going to be available can be very challenging.
It's tough to know where to spend money when you don't know what money you're going to get.
And oftentimes there is a significant delay in the state budget getting passed. So, we have to put services out there, and the funding will be to be determined because we don't know if we're getting it, if we're getting a cut, if we're getting what we had last year. But, it would be a dream for the state to be able to share with us what the plan is for funding for all of the programs that we already have established, because that would help us, more efficiently and effectively put our budgets together.
Is there a Narcan program in Richland County and Mansfield where people can get free Narcan?
Yes, actually, Starfish is one of our affiliate agencies, and Starfish, they typically have multiple units of Narcan, and I know UMADOP has a machine on site that has Narcan, and I believe Third Street Clinic has one too. I'm not sure. I can't speak for Third Street because they're not actually a mental health board agency, but I know they had at one point talked about, and I think they actually did implement a machine that people can access Narcan.
Unless they've taken out, I think, correct me if I'm wrong, I think Richland Public Health has a vending machine outside their building that one of the things it has or used to have, probably still does, is Narcan.
And for people that don't know what Narcan is, Narcan is a drug that reverses overdose and saves lives. It's not harmful to people if it is not a drug overdose that they're experiencing, and someone gives them Narcan because they think it is. It's not harmful. It is a drug that only helps in situations where people have overdosed, and sometimes it'll take multiple treatments of Narcan before someone can be revived. But Narcan saves lives.
Yeah,
it's a great drug.
Talk about the power of addiction, and this was a story I did a long time ago. But there was a gentleman who OD'd early in the morning. Fire department got there, Narcan, got him back. He ended up going back home. Early afternoon, same day, OD'd again. Fire department got there, Narcan, back to life. About 10 or 11 o'clock that night, same day, OD'd again. This time, no.
Lost his life.
I mean, it's just, Narcan's a wonderful thing, but even Narcan can't overcome that kind of human addiction. I mean, it's just hard to.
Well, and a lot of people.
Imagine.
I mean, we don't have to go into all of this, but I mean, a lot of people just from an injury, like addiction's like a slippery slope thing. It's not like you got to find yourself living in the streets or hanging with the wrong crowd to become addicted to some of these substances. And when people are in a bad spot and they're down and they might have an injury or something, and then it just kind of continues and creeps in, and that's why. I don't know. I think it's important to be empathetic to those situations.
Yeah. Personally, I agree. People do not understand how easily you can become addicted from certain pain medications. I just went through a rotator cuff procedure, and my doctor, he's like, I can give you some pain pills. And I said, what are you going to give me? And he said, Oxycontin. And I said, no, I don't think I want that. Even with all of my knowledge, and I know not to misuse drugs, and I don't have an addictive personality at all. But, I just didn't want that in my house, I know there's time and place for it. If I would have had rotator cuff surgery, now, that may have been a different story, but I had some injections of plasma into my rotator tear, and hopefully that will take care of what I need. But, it is scary. It's a very slippery slope, especially for someone that may have an more addictive personality.
Yes, I have an addictive personality, which is the biggest reason why I was attending college at The Ohio University, and some of my friends were finding out about some drugs that we could all imbibe in, and I said, you know what? I don't think I'm going to do that one or that one because I know what's going to happen. I'm going to really like it, and I'm not going to want to stop doing it. Yes. And I'm going to do it more because I do have that kind of personality, so I don't do it. But you know what? How has working in Mansfield and Richland County kind of shaped you personally, and what are you going to miss most about the job and the place?
What I will miss most and is my peers. You work for 31 years, and they become somewhat your family. And there's amazing people that work in our system. And I am so thankful they have the love and the soft hearts to provide the services that are so desperately needed. And they will carry the torch. But I will miss those people. Some of the most significant changes that I've experienced in my career is there's a few people that were children that were in foster care, a child that was adopted, that have sought me out, and I have contact with them very remotely, but I know their lives are better for what I did as a young career person. And you change one person's life, you change generations, and that carries through with mental health and substance use as well. You see someone you love or your friend or neighbor struggling, you intervene and you get them the services. You could change their life, and if they end up having children, you've changed generations. So I am so thankful to have had the opportunity to impact people's lives, and hopefully there are a lot of people out there that are better off for it.
Very good. Now, as you get ready to step into retirement, what are your plans? Are you going to travel, volunteering, spending time with family? What comes next for you?
Well, my husband, Jim, is a lover of travel, and he has some nice trips scheduled for us, and then some smaller trips scheduled for us through October. So we bought a camper. We're going to load up our dogs, and we're going to hit the road. We will also be doing some travel via airplane and boat. But really looking forward to spending that time with him and enjoying some of the trips he has planned for us.
Now, I think you had talked about maybe some farm life activity in the future as well?
Yes, we have a farm out on the outskirts of Columbus, and we have Wagyu cattle. We have chickens. I'm going to do some gardening, and if that's productive, I will do canning of that gardening. But if it's not, I'll probably just buy some stuff and can anyway, because I'm going to have a lot of time on my hands, and I'm not a good idle person. But just looking forward to doing some of the things that I love, and not having to squeeze it into my life. Right. I'm a maker of jewelry of all sorts, and we're setting up a nice big studio for me on the farm, that I can really enjoy that part of my life as well.
Nice. Well, Sherry, thank you very much for coming and being with us today.
Thank you, Carl.
And best of luck in the next chapter, which will be a lot more relaxing than overseeing a mental health and recovery services board. But all right, folks, we're going to wrap up today's show on that note. Many thanks to Sherry Branham-Fonner for joining us today. For now, thanks again to all of you for listening to the Newsman Weekly. I'll be back in a second to put a bow on this week's episode, but until then, remember what author Mark Twain once said: if you tell the truth, you don't have to remember anything.